If you're one of the millions of Americans living a life with pain, chances are you've been bombarded with options for pain relief. Dr. Craig Morton is joining us today, and he is a board-certified physiatrist who treats patients in pain every day. Thank you for being with us, Dr. Morton.
Thank you for having me.
Well, on a daily basis, tell me the number one complaint you hear from patients living in pain coming into your office.
Sure, I think the number one complaint is patients are frustrated because they've had pain longer than they want. Most of my patients are used to when they have a cold, it gets better in a week or so, or they get a cut, it's better in a week. But when they have pain, arthritis pain, tendonitis pain, it lingers for weeks. It starts to impact their quality of life. They can't do the hobbies they wanted, it affects their work, it affects their relationships. So in addition to actually having the physical pain, they're emotionally stressed out too. The struggle of living with it for so long and just it's not getting better as quick as they'd like it to.
So Dr. Morton, when you meet with these patients that are seeking pain relief, what have been the traditional pain relief options that have existed?
Sure, so there's several options that people are typically offered. A lot of times they'll be prescribed medication. That could be an anti-inflammatory, a muscle relaxer, or a pain medication. Sometimes they're referred to physical therapy or a chiropractor. In some cases, they've tried pain creams, over-the-counter creams or even prescription creams. From time to time, they might need an injection, a cortisone injection into the area of inflammation. And the last resort, of course, is surgery, which we ultimately definitely want to avoid if we can.
I know a big passion of yours is non-surgical treatments. Why is that something that you care about so deeply for the care of your patients?
Sure, for non-surgical treatment options, it might include topical pain medicine. It could be an oral pain pill like a muscle relaxer, anti-inflammatory. Sometimes we do injections, cortisone injections in the areas that are causing pain. We might refer them to a chiropractor or a physical therapist. Ultimately, our goal is to try everything we can without having to send them to a surgeon.
Of the non-surgical treatment options that exist, what would you see as some of the drawbacks?
Well, whenever we prescribe a pill for pain, maybe an anti-inflammatory or a pain medication, these medicines are metabolized by the liver and the kidneys, so there's stress on those organs. Some of the anti-inflammatories could affect the lining of the stomach, which can lead to ulcers or bleeding or elevated blood pressures. So a lot of times we try to give a medicine for pain, but it ends up causing more problems. If we do an injection, injections sometimes are painful. There's the risk of infection. There's the risk of causing more trauma. A lot of times the steroids we inject can raise blood sugar or blood pressures. So all of these great non-surgical options that we've historically relied on do come with potential complications that we have to be aware of.
Absolutely, and this is really where we've seen you go from Dr. Craig Morton, board-certified physiatrist, to Dr. Morton, inventor of a new pain cream on the market.
Yeah, so it's been fun. For the last several years, I've worked with patients, really have been intrigued with what topical analgesics or pain creams they've been using. I noticed that those patients that had creams that worked, they were passionate about them and it really helped target their pain relief, but a lot of people weren't getting relief. And there seemed to be an opportunity to take the best aspects of what my patients were telling me worked and what didn't work and try to really fine-tune it using my patients as my team to help me create a cream that consistently worked and relieve their symptoms so we could decrease the need for oral medication or injections.
Can you explain the development process that went into creating Acuplus?
Sure. What really led me to start doing this in the first place is, I've been practicing for 12 years, see 40 to 50 patients a day. So I've given tens of thousands of injections, I've written many prescriptions, I've seen lots of patients, pretty much every orthopedic condition you could imagine. And at the end of the day, it all comes down to how can we decrease side effects. Many of my patients had used pain creams over the years. Some worked better than others. And there's a lot of research available on what topical ingredients work best for pain. And so we looked at all of the research. We looked at what worked for my patients. We looked at what was on the market. We looked at what the FDA registered. And we tried to create a formula that was perfect, that essentially encompassed everything we knew helped with pain topically. And we relied on an FDA-approved lab to help us create a formula that we were able to test with our patients. And they did surveys and we talked and we tried it on shoulders and knees and hips and necks and ankles. And we were able to slowly work on the formula to where it was well tolerated, it penetrated quickly, it dried fast, but most importantly, it worked. And it was so exciting because they'd come back excited and they'd give me their pain diaries and show me how much better they were doing until it was finally perfect We finally had a formula that penetrated deep, it dried quick, it smelled great, and most importantly, it worked. We submitted it and it became FDA registered, so it's officially over the counter, and it's not only helping my patients, but helping hundreds, if not thousands of people across the country.
What makes Acuplus different than the other pain relief creams that are on the market today?
If you look at other pain creams, there's really two camps. There's the pain creams that have the menthol and the capsaicin or the camphor. They're the ones that have a scent or have a burning sensation. And then there's the holistic camp, the natural extracts, the essential oils. And if you look on the market and talking to hundreds, if not thousands of patients, and while most of my patients use one or both of these, a lot of times they're having to combine them and they're just not getting complete pain relief. We took the best aspects of both of these camps of pain cream and infused them together, so we have the best of the FDA registered products, the best of the holistic products, and we created what we call a super cream that has got everything that the studies show helps, and we consistently give my patients pain relief.
Well, with that, tell me about the ingredients that are all working together to offer that pain relief.
Well, there's an extensive list of ingredients, but some of the key ingredients that I think are beneficial that might help our audience today is menthol. We know has been out for a long time, and it's always been a good analgesic, and I still think it has its benefits. It works by, when you apply it, it has a counter-irritant mechanism, so it blocks pain signals to your brain as it evaporates, at the same time stimulating cold receptors. So it acts like ice without the effect of putting ice on your thumb or your hand, and so it really works well to decrease that topical inflammation and provide instant relief. We also have MSM, and that's a form of organic sulfur that improves permeability of cells. And what it does is it allows fluids to move through, so it really helps the cream penetrate. It helps flush out toxins like lactic acid. We have Arnica. Arnica activates white cells below the skin, which helps remove congested blood tissue and bruised tissue in the tendons and the ligaments. We have Magnesium and B6. Both of these ingredients have been used for thousands of years topically as applications for nerve pain, as applications for muscle spasm. We have a few essential oils. We have willow bark extract. It acts very similar to aspirin, except it's not aspirin. It's all natural, but it's been anti-inflammatory since the early Middle Ages. We've got licorice root extract, which acts like cortisone, but it's not. It's a natural essential oil that decreases inflammation. We have glucosamine. Glucosamine is in all of our bodies. It's been known for its anti-aging and anti-inflammatory properties, its regenerative properties. We have Boswellia serrata. It's one of the #1 holistic anti-inflammatories on the market. It's even been touted as a replacement for prescription anti-inflammatories. So it's just, the laundry list goes on and on of what's in the cream.
Tell me how you actually will apply Acuplus.
Sure. So I typically tell patients to find the area that hurts and apply it liberally for about 10 to 15 seconds. And what that's going to do is it's going to activate the ingredients, and after a minute or two they're going to feel a nice cooling effect, and that's the medication penetrating. And really within 5 to 10 minutes, most patients start to feel some significant relief on that visual scale of pain. They knock down a few points and sometimes go down to 0, but they're all doing really well. So it can be used up to 5 or 6 times a day.
So just how does Acuplus work?
Well, if you think about taking a pill for pain, you're going to take a little pill, it's going to go in your stomach, it's going to dissolve through all your organs, and you're hoping that a little bit makes its way to the area that's hurting. As soon as Acuplus is applied to the area that hurts, you essentially have an army of ingredients going to work for you. The initial ingredients stimulate the nerve receptors, overriding the pain pathway to your brain, and also activating cold receptors, similar to putting ice on something that hurts. We have ingredients that help the medicine penetrate, ingredients that help flush out toxins like lactic acid. There's also ingredients that help clear out bruised tissue and scarred, inflamed areas that have built up from the trauma. We also have ingredients that are going to help move bruised tissues out of the fluid. Some of the ingredients help the medicine penetrate. Some of the ingredients help kind of clear out scar tissue, and other ingredients are antioxidants that help take away the inflammation. So we have lots of guys working together to tackle that one area that hurts, instead of just popping a pill and hoping a little bit makes it over there. And so it's really just a full battle against your pain.
And it's truly targeted relief.
Yes, it's directly applied to what hurts. So if your shoulder hurts, you put it on your shoulder. If your knee hurts, you put it on your knee. And it's targeted relief, and it works quick without the side effects.
How have patients responded to using the cream?
Oh, it's been overwhelming and really exciting. We've had patients we've been treating for years now that are doing excellent. We've sold thousands of bottles across the country. We're getting testimonials. People are sending us gift packages saying it changed their life. Many patients are getting off of oral pain medicine. They continue to order it, they continue to share it with their friends and family, and they're quite passionate about it, and we've been really excited with the response.
So the big question now is, how can people get their hands on Acuplus?
Well, right now they can get it at Acuplus.com, and we also have it on Amazon.com. The sizes available are a 2-ounce jar, a 3-ounce roll-on, and a 4-ounce jar.
Fantastic, and I've heard that there's some exciting news for people that enjoy a good bath.
Yes, this is true. We've had many patients enjoy it so much they said, I wish I could just bathe in it. So we actually listened to them, and we formulated a version in a bath bomb. So we took the best ingredients that would be tolerated in a bath bomb, and it's coming out soon.
So many people tout the benefits of CBD when it comes to pain relief. Is this something you could ever see Acuplus involving in the future?
There's a lot of press right now on that, and CBD is helping lots of people. The research is all over the place, so we're excited about it, and the laws are changing. In fact, we are currently looking at adding CBD to Acuplus to have an Acuplus with CBD option. So keep your eyes out for that. It should be coming out soon.